Hello, everyone, and welcome. Today, we are going to be talking about the disclosure of ownership and controlling interest form. My name is Charlotte Rowe. I am a provider network analyst at Oakland Community Health Network, and I'm going to turn it over to Alexis to introduce herself as well.
Hello, everyone. My name is Alexis Mitchell. I'm a quality analyst at OCHN, and I work with credentialing.
Today, we are going to be covering three main learning objectives. We're going to be doing a brief overview of the D&O form. We're going to be looking at the form itself and talking about how to complete it. And then we're going to be covering how OCHN safeguards your information. There are two major purposes of the D&O form. One is ensuring Medicaid program integrity and making sure providers are eligible to bill Medicaid. Federal regulations require the D&O form completion, as does OCHN's contract with providers. The D&O form is required at the time of initial credentialing, which occurs prior to joining OCHN's provider network, and every 2 years at the time of the provider application. The attachment D of the provider contract that OCHN has with our organizations also indicates that updated information must be submitted to OCHN within 35 days of any changes to this information. Next, I am going to hand it over to Alexis, and she's going to be covering how to complete the D&O form.
Thank you, Charlotte. So now that we have a general overview of the form itself, we're going to kind of switch gears and talk about how to actually complete the form. So as you can see here in the slide, we have a screenshot of the top of the form. As you complete it, or before you complete it, you can review these directions. It kind of gives you additional information and just kind of a general guideline that we're also going to be reviewing today. So how to complete the D&O form. So the D&O form submission should include the following. It's going to have the form and the master list. So this is technically two documents. If you receive it in a PDF form, the master list, which is an Excel document, is going to be embedded into the PDF form. How you access that master list or that Excel document is actually going to be by clicking on the attachment icon within the form. We'll show you a screenshot of what that looks like in the next slide. And as you're completing the form, of course, ensure that you answer all questions and leave no sections blank. So this is a screenshot of the page, the top section here with the red box outline of how you can access that master list. So it's kind of hard to see in the screenshot, but it's going to be a little paperclip icon. And it is kind of hard to access, so you may have to double click. There may be a pop-up window asking if you want to open it. You can go ahead and press OK. And then in the next screenshot or the lower section of this slide, you can see this is what the actual master list should look like. We have several columns to be completed, and all of them are required to be completed so we can run the OIG checks that we run, which are required. We have the first name, last name, the provider, so this would be your organization, the individual's date of birth, their social security number. A quick note for this, we do need the full social security number. Unfortunately, we can't work off of the last 4 digits, for example. The address, which would be personal address, city, state, and zip code. And then it's cut off here, but in column J, it would be percentage of ownership. So say if you have 2 individuals that share the ownership 50% split, it would be 50% for each individual. And then the last column would be their job title. So as you saw, we do ask for the social security number. And of course, that is sensitive information. So I want to talk about really quickly how we use this information. OCHN utilizes secured verification software called Streamline Verify that searches multi-state and federal Medicaid and Medicare exclusion databases. The names of individuals with agency ownership or controlling interests are entered into this search system, Streamline Verify, to make sure individuals are not excluded from providing Medicaid services. And as I mentioned, we do need the full Social Security number and date of birth and all of the information in that master list to complete these checks. So one of the biggest questions we get from providers as they're completing this form is who should be included on the D&O form. So I'm just going to give some quick definitions to kind of help this process as you complete it. So an owner is a person or business entity who owns 5% or more of the assets, stock, or profits of the provider entity. Someone with control directs the provider entity. So this could include directors, trustees, and officers of corporations and partners in a partnership. And this would be non-applicable for a nonprofit or organization. However, you do still have to complete the rest of the form. Continuing with the definitions, a managing employee is someone who makes the day-to-day decisions for the provider entity. So this would be, if you're looking at an organizational chart, these employees would typically be listed under the corporate officers. So some job title examples could be general manager, business manager, administrator, director. And many OCHN providers include board members as well, even if they are unpaid. We include chief level staff, and directors, managers are also applicable. So talking about how we safeguard this information, because it's very sensitive information that we are asking of providers. So the information is sent directly to OCHN quality analyst, which is myself currently, who performs the verifications via Streamline Verify, which is also a secure website. The non-redacted forms, so these would be all of the forms completed and sent over as is, are stored in a secured folder, and they are accessed only by the quality analyst, myself, who completes the sanction checks. Once these sanction checks are completed, the quality analyst, or myself, redacts the sensitive information. So again, this would be the Social Security number, date of birth, etc., and it is uploaded to the credentialing smartsheet to ensure privacy is maintained. And I won't read off this list of policies. This is just for your reference, but these are some OCHN policies about protecting information as well, if you'd like to review those. And of course, just a quick section on how to access OCHN policies. They can actually be accessed through the provider extranet. And you can't really see it, but I believe it says OCHN policies. It's in that little highlighted section with the arrow. Okay, that is all we have for today's presentation. If you have any questions, please don't hesitate to reach out to myself. I have my contact information here by phone or email, whatever works best for you. And I thank you all for your time.